Hi, everyone. I wanted to take a minute to kind of hopefully, answer some questions regarding the expectations when it comes to grading a student in Upscale. So the students are required to put in the patient information when they are seeing a patient, and the students are required to create a new appointment in Upscale every single time they see the patient. So let me just show you what that looks like. So the student is responsible for this. So the student, here's the date. The student would put in clinical level 3. The treatment phase, if it's the first time that the student is seeing the patient, they're going to pick new patient appointment, or if it's the same patient in a series, when the patient came back, they would do continuing care appointment, or they would do a recall appointment if the patient is on a 3, 4, or 6 month appointment, or if it's a 6 reeval. So they would choose that. So I'm just going to go ahead and click on new patient appointment. This is the first time I'm seeing the patient. Then the student is required to put their name in here. And then we're going to add the patient. And then the student will assign the instructor who's working with them that day. Once these 6 boxes have been completed, then the student will go ahead and save and close this appointment. When you go to a point, so that's what the student does. When you are going in and grading your students, you're going to go ahead and go to appointments, and you're going to see what instructor is assigned to which student. So I just created this one. So this student assigned me as their instructor. You will see that the series completed is false. That means the patient is not completed. Once this, so then you'll see critical fail assessment, and then it will show right here that it's a new patient appointment. So I'm going to go ahead as the instructor, and I'm going to do this drop down to actions, and I'm going to go to the appointment. When I go to the appointment, I will see the 6 boxes that are highlighted that the student filled out. Under here, we will see that there's a series that's added. It says TBD. It has the date, calculus, the ASA, the sextant or quad, the procedure type, the procedure. The age group will already hopefully be entered in. If not, we would have to manually enter that in. The AAP classifications with the stage and the grade. So as the student starts completing the patient, we can, as instructors, fill this portion out as we go. So let me show you how that works. So I'm going to say that student 20 is my student, and she is starting the care assessment. So we're going to go up to care assessment. And here are the things that we are going to grade the student on. This gray or kind of bluish box, you can just X this out. So these are the things that we are going to be grading each student. So we have the assessment. I'm going to hit diagnosis. We'll have the dental exam. We have the planning. We have the implementation. And then we have the evaluation. So this is where our add pie comes in. So I'm going to go through each section for you. So let's click back on assessment. And I'm going to say student 20 signed up and let me know that they want to do their medical history. So I'm going to go ahead and use this downward arrow, and I'm going to click on it. Now, you are going to see that the grades always default to NA. You will see that across the board. NA obviously means not applicable. And then you will have, like it says up here, errors, and we'll say 0, 1, 2, and 3 plus. What this means is that 0 means 0 errors, 1 error, 2 errors, 3 plus errors. Okay, so you have to determine, does the student, is there any error or it's not? So we're going to go through each area and we're going to determine, are we grading this patient, the student on this? So did the student interview the patient for any yeses? Yes. Did they take respirations? Yes. Did they appropriately document medical history? Yes. So we're going to go through each line to determine, if they met that. And I'll be like, did they recognize special needs? I'm going to say no. Okay. If you say no to anything in this box, always document why you took the point off. So then I would say, no, she did not meet the special needs requirements. Patient is in a wheelchair and needs assistance in transfer, has caregiver with her. Okay. So then the student will understand why I took that point. Recognizes the need for medication. Yep, she did that. And then it says here, continuing care medical check. We don't check this unless the patient is coming back, and then we will check the medical for that. So since it's the new patient, we are going to go ahead and give all of these points. If the patient comes back for an appointment within a series and there's no changes in their medical history, then all of these would remain NA, and then we would just click on the continuing care med history check. We just don't want to overinflate their grade. So then I'm going to scroll down and we're going to do the extra oral and the intraoral exam. So these are all the things that the student is required to do, and the instructor is to grade. So again, here's your errors. Everything is going to default to NA. This is 0 errors, 1 error, 2 errors, 3 plus errors. And then you just have to document, like, yes, they got it. No, they didn't. We'll say no to the buccal mucosa. I'll just say bilateral lemia alba. Maybe the student missed that. And then we would just continue to document or grade everything that the student had documented. Right here, it says patient assessment updated at subsequent appointments. If they're seeing the patient for the first time, then this is going to remain NA. Giving them these points is going to inflate their overall grade. The only time this comes into play is if they come back again for a second appointment in a series. Say the student was unable to get the patient done that appointment, and say they needed to add something or subtract something in this area and they updated this, then we would keep everything at NA because they've already been graded on it. So we don't want to grade them again, kind of like with the medical history. And then you would give them, what point or errors that they deserve. For periodontal findings, we do probe the entire mouth to make sure that we are in alignment with the students. We are allowed to be 1 millimeter off. So as long as we're 1 millimeter off with the student receives full credit. If it's more than 1 millimeter, then that is when the student is going to start losing points. We're going to take a look at the gingival description, the pocket depths, the margins, bleeding on, probing, exudate, mobility, furcations, and did the student, grade and stage or classify their patient correctly. So with the gingival description, just a couple things with this. I have instructed the students to avoid the word inflamed. I think that the word inflamed is too subjective. We want to be a little bit more objective as far as what does the inflammation look like? Is it red? Is it smooth? Is it shiny? Is it spongy? Is it puffy? Is it festooned? Is it rolled? So things like that are going to be a little bit more descriptive when we come to the gingival description. So that's something we really want to hone in on. So take a moment, and if the student is not seeing something that you are, please just kind of point it out to them. And, the other thing too is making sure that the gingival description is kind of matching, the bleeding on probing and the overall classifications. If there's a lot of bleeding on probing, but the gum tissues are nice and pink and firm and stippled and knife-like, that doesn't really match. So just make sure that there's a correlation that's happening with that. So then, we would determine, that the student did really well. Now let's just say the student did well on all of this. Okay, you're like, yep, everything is great. You don't have to go and click every single box. You can just click this 0 and it automatically will go over for you. So that's a little shortcut. For radiographs, we are going to pass on this. We are not going to grade radiographs in this because we have another way of doing that. And then here is your stain and supra detection. Now, the detection for this area and for the sub, this is not for removal. This is 100% when we're doing the calc detection. So the student is required to detect the entire dentition, where we are going to check one quadrant, and the quadrant is up to you. And then depending on how many areas are missed will determine what score they get. So again, 0 means that there's no errors. But do you see these things behind the area where it says a supra and down here behind sub? This means that this student can miss 0 to 1 0 to 2 pieces of calculus, and they get 3 points. All right, if they miss more than 3, 2 points, 4, 1 point, 5, 0. So just go ahead and make sure that you are looking at these levels. Okay, when you're all done, we'll just say they got everything. Okay. So when they're all done, if there's anything missed here, I like to put in the notes on the side which tooth was missed and the location. That just kind of gives the student another level of awareness if it's a consistent area, like if it's a consistent, is it always on the distal? Is it always on the mesial? Is it always on the mandible? Is it always on the maxilla? So kind of helps the student hopefully self-aware on themselves on how they're doing. So once this is all filled out, you're going to save it. And if they don't do it, that's okay, because we can always grade at another appointment depending on where they stop. So I'm just showing you from a start to finish. So we're going to go up to the top, and now we're going to go to diagnosis. We're going to click on the exam. And this is where a lot of the hard tissue is going to be documented. Deviation, occlusion classifications, overbite, overjet, end-to-end, edge-to-edge, restorations, any suspects. So you would grade the student appropriately here. And then you would press save. Then we'll go up to planning. And then this is the treatment plan. Okay. So if the student got all of these right and the treatment plan has been signed by you, the student and the patient, that's great. We're going to give them no errors. And then we're going to go ahead and press save. When it comes to implementation, this is where it gets a little tricky with grading. So if we click on the preventative care, there is a lot in this preventative care that we are not going to be doing on every single patient. So if this one, we have to be a little bit more mindful on how we are grading the patient. So for example, do we do the tobacco cessation on every patient, or provide dietary counseling, or properly care for the removable appliance? Probably not. So whatever the student does not complete on this section, keep it as NA, okay? So the patient, did the student consider the patient's overall health? There was no errors. Yep, recommended the toothbrushing. They did do the tell, show, do. They did the PHP, but they didn't do the tobacco. They didn't do the dietary. But, polishing methods, yeah, they polished the patient. They applied fluoride. Patient doesn't have a removable appliance. So none on here, and that's okay. So just make sure that you're only giving the grade to what they do. These NAs aren't against them, but it doesn't help them either. So it's just like it doesn't exist. Okay. Pain management. This is only if the student performs any type of injection or nitrous oxide. If they don't, skip this section. For instrumentation, this should not be filled out unless the student is doing a skill assessment. If the student is doing a skill assessment, then you can go ahead and fill this out, but if not, I want you to skip this section. For removal. So for removal, this is how we can do it. So it's going to say deposits remaining, okay? So you're going to see upper right, upper left, lower left, okay? So if the student has done 0 to 2, so if they have up to 2 pieces that are missed, we're going to give them the 1.5, okay? If they miss 3 spots or more, then they're only going to get 1 point for that quadrant. Okay, so you'll have to just take a look at that one quadrant and how many did they miss in that quadrant. And then that would determine, that would determine what grade. So each quadrant is going to be graded separately. Again, any areas missed, make sure you put it into the comments so that raises awareness to the student. We do check for biofilm. All right, so if there's any biofilm, if they missed nothing, that would be 0 errors. If they missed 1 area of biofilm, then they would get this grade, 2 areas of biofilm, or 3 or more. Tissue integrity is the same way. If you see no tissue integrity, go ahead and put 0, okay? If you do see some tissue trauma, then you can go ahead and grade appropriately and then make sure that you put a comment. When everything is graded on this sheet, you're going to go ahead and press save. And we're going to go back up to the top, and then we're going to do evaluation. For the evaluation, we're always at every appointment, we're going to be grading their professional conduct. So if we click on that, these are the areas of professional conduct. If you feel that the student has met all these competencies, go ahead and you can press pass and it will all move over to pass. If you feel like there isn't, and there's one that they didn't do well on, then you can go ahead and click on that and then make a comment of what you felt was not competency in. This has to be done at every single appointment. The student does not receive any credit for this, but it allows us to track on how they are doing with their professional conduct. Down here, you're going to see professional conduct points. This is where if you feel that there was a discrepancy in their professional conduct, this is where we can take points. And this is where you can talk to another instructor to just say, okay, this is what I saw. What are you thinking? Okay, we need to work on this a little bit. Like, how much does each professional conduct level, how many points is each if something is failed? Dismissal. Yep. So sorry, I want to back up. I apologize. So then let's go to appointment management. So if we click on appointment management, this is where the student gets documented for their notes in the computer. Now, when it comes to documentation right here, I have been pretty strict when it comes to the oral hygiene instructions, making sure that each student is in fact explaining to the patient what their caries risk is, any modifications in their diet or any recommendations, along with their brushing and flossing habits and the role of bacteria. Failure to do so, they should lose all of their points. And then in the comments, I usually write something about that. So I've been taking a lot of points off for this because I just don't feel like our oral hygiene instructions are really meeting that expectation threshold. And I have been talking with the students on this, so I'm really hoping to see an improvement on that. Did the student provide privacy and upholding HIPAA? The patient satisfaction, was that completed? We do have that QR code. Like, did we have the student say anything to the patient about it? Did we refer to DMD or their dental office? And did they create a good recall? So this should be completed at every single appointment. And I'll just say everything was great. So I'm going to just put 0 errors. And down here, this is dismissed patient on time, ethical behavior, unsafe practices, and did not obtain signatures. This is all where additional points can be removed if you feel that there was something missed along the way and you felt like you needed to take points. If you do, this would be the area where you would take the points and then make sure that you document that. So once all of that is completed, you're going to save this information. Okay, so the patient is done. The student has done their scale check. They have applied fluoride, and this patient is done. Now what we need to do is we're going to go back to the details tab, and we're going to fill out all of this. So I'm going to say, yep, the patient was at calc level 2. If this comes up, change in the clinical level of calculus will cause the care assessment and self-assessment to regenerate. What this means is that the higher the calculus, the more points the student can lose. So just press OK. I'm going to say the ASA is 2. We completed all 4 quadrants on this patient. And I'm going to say that this patient was a new patient, and we just finished the patient from start to finish. The procedure, you don't need to click anything on this unless you have done an intraoral camera or if this is a reevaluation. And then you would just put the number here. So how many intraoral camera pictures did you take? And the peri reeval, you would just turn that to 1 because it's only 1 patient. Then here is the demographic. We'll say this patient is an adult. And then we will say that this patient was healthy. So you'll see healthy, healthy in a reduced periodontium, stable periodontitis, localized or generalized gingivitis, whatever they are, just put 1 because it's 1 patient. If they are getting graded and staged, here are your stages and here are your grades. If your student has any special needs, they will write them in this box. And if you approve the special need, then you can go ahead and put your name down here and go ahead and sign. For the special needs, they need to know what the special need is, and then how did the student modify the treatment. Okay, so we want the modification in here. So, for example, patient strained their neck and was unable to turn to the right. And then I modified the treatment because I stood when scaling the upper right quadrant. Something like that. It needs to be like what's going on and then what did the student need to do to modify it. If you approve it, you go ahead and put your name down here. Okay. Last but not least, we need to close the series. You only close the series when the patient is absolutely 100% completed. You're going to go to this edit button, and we always put the calc number in what the patient is. So this patient was a calc level 2. We have the summer requirement, so make sure that it's on the semester that we want. And then we're going to put the end date. All right. So this means that this patient is completed. I'm going to go ahead and click save. And you're going to see right up here, it says series closed. We're going to post it to Gradebook and we're going to save. Now, what this does is if I go back to appointments, I'm going to see that this student finished a Calc Level 2 in Clinic 3 on this date. So this true means that the entire patient is completed and they are coming back for a recall patient. I hope this has helped. Please let me know if you have any questions.